welcome to For the Record. I'm Kritika Kumar. Joining us tonight via Zoom is Head of FEMET, Dr. Nasedra, to talk about on-the-ground operations. So let's get into it. Dr. Nasedra Bulavinaka, and thank you so much for joining us tonight. First of all, Dr. Nasedra, as we all know, the FEMET facility, was set up as part of the COVID-19 response to assist in replacement of Lotoga hospital services for 21 days. So, Doc, what types of care and services are provided for adults and children in the FEMET field hospitals?
Thank you. For the FEMET field hospital, since we started in June this year, it became the non-COVID facility where we took over the services, emergency services from CWM Hospital. And as time goes on, by July, we then switch over the role of FEMET field hospital taking over the COVID care in the facility. And since July until now, we are looking after COVID cases in the FEMET field hospital based at the Vodafone Arena and the National Gymnasium. And we look after adults, and there are also some children being looked after in the facility.
So, we have heard about some of the heroic stories, such as that of a successful emergency surgery in Kandavu. Have there been any other similar stories at the FEMET hospital, perhaps that of newborns?
At the FEMET field hospital, in Suva, we don't do any deliveries. Unlike the FEMET field hospital, we had Lutoka, where we conducted maternal deliveries at the field hospital and also at the MVV with apart from the emergency trip taken by the team to Kandavu, there was no other emergency surgery or delivery in the current FEMET facility in Suva.
And sir, just in terms of the assistance that is being provided by FEMET and just in terms of some of the services that is offered by FEMET, what are some of those at the moment?
Thank you. We have been conducting surgeries at the FEMET field hospital, and until the end of June, when we transitioned the services back into CWM hospital, we have stopped surgeries at the FEMET field hospital and the MVV Gueti. When we took over COVID, the care of COVID cases, one of the major role that we also took was the mobile response team. So we reach out into the community by setting up a few mobile teams, and we try to get to the COVID positive patients out there in the community to make sure that we reach the sick before they get worse, and we do risk assessment. And those that are sick, we bring them into the facility, or we refer them to CWM hospital. That is part of the mitigation phase for the COVID response. So we reach out into the community to make sure that we get those that are sick, that they can get the care early. And also in that way, we also raising the awareness in the community. We assisting in with the public health team, and that the whole of government response team out there in the community. And also one of the other role that we undertake is the emergency retrieval and the ambulance services. That is another arm of FEMET that operated during the COVID-19 mitigation phase from July. We set up the ambulance and retrieval services. That is also a center that responds to the call line of 165 and also 158. that we reach out into the people that are calling, asking for assistance, for help. And that is the other major activity done by FIMET.
Sir, just in light of the deployments, as you mentioned this year, one of the deployments were to Kandavu. Just in terms of past years, how many island or rural developments, how many island or rural deployments has FEMET done in past years? And could you tell us the works done during these deployments?
Thank you so much. By the time we come to the COVID pandemic, the FIMET has conducted what I can say is extensive operations throughout Fiji, both on the main islands, where we reach out into the communities in main island in Vitilevu and also in Vunulevu, where we set up tented facilities. We go into the subdivisional hospitals where the clinical teams do clinical services, surgical operations, maternal deliveries, attending to specialist clinics. When we reach out into the maritime division, that is where we use the MV Vegweti, which is the medical boat. And the medical boat, if I can want to say that the medical boat has reached almost all the maritime islands in Fiji. It has been to Kandavu, to the Low Group, and also to the Lomaiviti Group. And it was also used by the Western team in their outreach to the Sawas. And it was also used by the Northern team when they conduct specialist outreach in the Northern Division from Yandua. They even reach up to Tikumbia and coming down the other way to Yathata. So the MV the only island that has yet to be visited by the MV is Rotuma. That is the only island left for the MV to visit as part of the FIMET outreach operation during peacetime. And that concept during peacetime has really helped us in our FIMET mobilization during disaster. In 2019, in the wake of TC Sarai, TC Tino, and TC Herald, TC Anna, and those disasters, it was very quick in terms of FIMET and the medical team responding to the communities that are affected, because we have been doing outreach during the peacetime. So when it comes to disaster, it was very easy for the team to get deployed because we've been doing it. And when it comes to COVID, we sort of have the know-how, setting up a field hospital, putting the boat, so combining the operations. That know-how that we have developed during peacetime has really helped FIMET, especially the Ministry of Health, in spearheading some of the medical responses, and most importantly during this COVID pandemic.
Thank you, Doc, for that response. We'll take a break now and we will be back with the discussions on COVID-19 response. Welcome back. Dr. Nasedra, as we know, the COVID-19 has disrupted a lot of day-to-day processes, not sparing health services around Vitilevu. So how does FIMET respond to COVID or suspected patients who visit the FIMET hospital? And what's the average number of patients that would normally present to the FIMET facility?
The FIMET field hospital was when it was set up in June this year. We've participated in the COVID response, which is looking after non-COVID, and also then we look after COVID cases that presented to the facility. On overall, when we set up the field hospital in Suba, we managed to attend to more than I just want to make sure I get the figures right. We've had a total of more than 700 admissions in the FIMED field hospital, and most of these cases were referred from the health facilities around Suva. Some of the patients came directly from home into the FIMED hospital, and some were referred from CWM hospital, or they were admitted at CWM hospital, and when they get better, they were referred down to FIMED field hospital. When we came into July, when we took over the COVID operations in July, we sort of exchanged roles with the CWM. So that is when the concept of the intermediate care facility came about, with the assistance of ANZ Med. So we set up the FIMED field hospital now stands in between the way of home, the other health facilities around Suba and the Central Division, and also CWM. So the sick, when they come from home or the health facilities, they come through FIMED. If they get better, we continue to look after them. If they improve, we send them back home. But if they do get very sick, we then send them over to CWM hospital, because that is where the capacity for looking after critical cases is. FIMED can only look after moderate until severe cases. For those that get very sick, we refer them over to CWM. And there's also when those critical cases or severe cases were in CWM gets better, to help with that load, those cases are being referred, transferred again to FIMED field hospital. We look after them, they get better, and then we send them home. So it is sort of, in a way, sort of a halfway home facility, because we don't want to increase the risk of COVID to the respective families. So that is why we keep them until the 14 days is over, and they get better before we send them home. When we also look after emergency cases, we make sure that while they are in the isolation areas, they continue to receive the care. For example, if they come in with a chest pain, they might be suspected, they might have a heart attack. We can't get them lying around waiting for the test result. So while we set up an isolation area to make sure that patients do continue to receive the care while waiting for the swab result. And that is where we then decide where do we send these patients. If we think that they need that specialist care that is only available at CWM, we then send them over to CWM. So that is how we operate a field hospital and also the intermediate care facilities.
Thank you, Dr. Nasedra. That's it for this segment. We'll take a small break. Stay with us. Welcome back. Thank you so much, sir. Just in terms of in this segment, we will be talking about the international team who is currently in Fiji and assisting our FEMAT. How effective has the help from OSMET and ASMET been so far?
Thank you. In every disaster, one of the important things is for us to assess our capability and what sort of assistance is needed. When, um, when do we need the assistance? How much of assistance do we need, and the timing for the assistance. So that's, as you realize, as you've mentioned, that we were assisted by ANZ Met. They came over, they assist FEMAT. We came to realize that when there was extensive community transmission in the Central Division, we thought that it is good that we have extra help from our neighboring countries. And they came over and they offered quite a lot of good support for the Ministry of Health, and especially with FEMAT and CWM Hospital, and even they move on to the Western Division. So they were very helpful in giving extra insight into our operation. Sometimes getting another pair of eyes to look at what we are doing is something good, and that is something that they came in, they saw what we are doing, and we discuss on ways in which we can maneuver the operations that we are doing, make it better. One of when they come in, they really help us in setting up the national gymnasium as part of the intermediate care facilities, and that setup really help us because it is from there that we get a lot of support, training, and ideas on how to set up the flow, the setting up of the beds, and making sure whatever needs to be available for the staff, the isolation, making sure that the setup will minimize the infection for even the staffs themselves. And it worked out very well for the National Gymnasium. None of the staffs that work in the National Gymnasium were infected with the COVID-19. And that is the good thing that we learned from ANZ Med. And not only that, they also really helped a lot in infection prevention control measures, some of the measures that we are doing. Some of the standards, the procedures that we were doing, we had to modify it to suit the situation that we are facing. They even introduced the rapid testing kit and conducted the training. And they also help us in all the operational aspect in terms of data collection, what should we monitor with the patients that are suffering from COVID-19. So when everything was running smoothly in Suva, we thought with the guidance of the Ministry of Health headquarters, they assisted us in the Western Division. Now, the other aspect that they also helped in is that they came in and offer assistance at CWM Hospital so that we can continue the normal services in CWM under the COVID pandemic. So they help us in continue to providing surgical operations, maternal deliveries, and they even help the teams in doing that. They offer some specialists to come and work at CWM Hospital, so we can also free up the doctors and the nurses at CWM Hospital so that they can help in reaching out into the community. So those were the support that we get from the ANZ Med team when they came over to Fiji.
Sir, earlier this week in a parliament sitting, the health minister has highlighted that some other overseas experts are showing interest in coming and assisting Fiji, and one of those team is an American team. So what kind of expertise are they expected to bring in Fiji to help us control this widespread transmission of COVID-19?
Yes, there is an interest from a US team. They will. They've offered their interest in assisting. Discussions are still going on how we can utilize their assistance. They're coming in with some medical specialists, some paramedics, and so we are already discussing on where we can station them, utilize them to make sure that we can all benefit from the specialist knowledge and skills that they have. So we are looking at maybe we'll get them to work with the specialist team in the clinical care for COVID cases. Looking at some of the expertise they have, we are thinking of getting a few of them to assist in the retrieval of six sick cases. There are a few paramedics that are coming with a US team, so they will be useful in our retrieval team, and they also have some expertise in data management and data collection. And so those are the areas that we are currently discussing. So one of the important things is for these teams, when they come in, the most important thing is for us in the local health team to be to know the support that is needed, and we can use them so that it can really benefit the whole operation. Because they come with a lot of skills, knowledge, and experience. So we need to put them in the right place so that we get the benefit in this COVID response.
Thank you so much for that response, Doc. Moving on, we'll take a short break now, and after the break, we'll be discussing about the critical cases of COVID-19. Welcome back. Thank you so much, sir. So, Dr. Nasedra, as you are aware of the number of deaths that we've been recording in the past weeks, and also the number of people in critical conditions as well as severe cases. When we say critical condition and severe COVID-19 cases, what exactly does that mean?
Thank you very much. When we mention critical cases, we basically refer to patients that have severe shortness of breath as a result of the COVID infection. And most of them, when they reach that stage, they normally will require ventilatory support. FEMAT has had received quite a lot of severe and critical cases. One thing that we found is that have helped during the COVID response for this severe and critical case is early identification of the sick patients. And what we do, we came up with something like a scoring system that help us in identifying the level of care that a person needs. So with that scoring system, it gives us clear direction on where that person needs to be looked after. Can they be looked after at the FEMAT facility, or they need to go to CWM hospital? Now, for critical cases, FEMAT is not equipped for managing critical cases, those that require organ support. They will have to go to CWM. For severe cases, we keep severe cases, we can manage them. And when they reach a stage, if they deteriorate, then we send them to CWM. But we've got quite a number of severe cases that do recover while at FEMAT. So these are the patients that most of these COVID cases, they benefit from oxygen. Oxygen alone sometimes will help the patient. And then there are some other medication that will be given when they reach that window of being severe and critical, that they will receive some medication to help the organ system in responding to the impact of the virus. And with the FEMAT, we find that with that early management, we got good survival rates for severe cases that come through FEMAT. So it's around 75% of severe cases that come into FEMAT, they got better. They got better. And one of the things that we've realized is early identification of the sick. And that is where we got this idea that we need to identify them early. So that's why we are then moving our mobile response team out into the community. Get to the people early, identify those that are sick so that they can be brought into the hospital and they be looked after, and most of them will get better.
So just in terms of identifying the severe cases at an early stage, so what are some of the challenges that the FEMAT might be facing in order to identify these severe or critical patients at an earlier stage, so that they don't go up to that stage where we lose them, or there's a disadvantage for the patients?
Yes, one of the early challenges that we face is there's quite a lot of positive cases, and there's quite a very big list that we have to go through. The line list of positive cases. As you will know that we come to a stage that there were around 700 to 1,000 cases a day. And to go through all of them, it takes quite a number of days. But what we have done is we narrow down into the high risk age group. So we identify the more than 60, more than 50. We identify them from the positive line list, and we try and contact them. At the same time, there is the communication and all these media statements by the Ministry of Health is for people to call in early. The media statement saying if you have breathing problems, if you have a fever, you can call in 165. So setting up that call center, that call line also helps, so that not only while we are trying to reach out to the communities, there is also a pathway where if somebody is sick, they can call the 165 call center, and that can also redirect the teams on the ground to reach out to the communities. So it also deals with our health-seeking behavior, how we communicate out to the teams that are on the ground, and also the call center, so that appropriate help can be mobilized early.
So, just in terms of providing assistance, you mentioned that 70% of the patients who are admitted at FEMAT are fully recovered. So, just in terms of the current admissions, how many patients are there at the moment at the FEMAT hospital?
Thank you. In early July, we set up a facility of 200 bed facility. And since we started, we've been having a 70 to 80% occupancy. So we were very busy early in July. But in the last week, we have noted a reduction in the number of patients that are admitted in FIMED facilities. So as we speak, there are 52 patients admitted in the FIMED field hospital. So we've noticed that there is a reduction in the number of sick cases being admitted in the FIMED field hospital.
Vinaka Doc, that's it for this segment. Stay with us for more. Welcome back. Thank you so much, Doc. Dr. Nasedra, just in terms of this pandemic has made us realize certain areas we can improve on, and what would you say are some of the areas you and your team will be looking to strengthen post COVID-19?
We've learned a lot of lessons from COVID-19. I think one of the greatest learnings of COVID-19 is prevention. Our COVID measures, hand washing, covering of face, social distancing. So one thing that we have learned is the strengthening of awareness, strengthening the preventative measures for any pandemic that we come across. I think that's one of the most important learnings of this pandemic. We still stand with prevention is better than cure. So instituting the preventative measures early and sustaining it over time will help us. The other thing that we have learned is that our system needs to be prepared. And I think we have learned from disasters. And I think one of the other learnings from this pandemic is we've been responding to disasters, but I think we also need to prepare ourselves in responding to outbreaks. And the other thing that we have learned is something that the Ministry of Health have been trying to strengthening is the universal health coverage. So even when it comes to this pandemic, one thing that is important that we found is we still need to reach out to the community. We're getting the specialists closer to where the people live, and we continue to support, raise the awareness, and providing that clinical support and specialist services to the people. Sometimes they are having difficulty reaching the health facilities. So when the team mobilize, that is a very good way into reaching out to the people so that we can identify the sick early before they deteriorate. So universal health coverage, reaching out into the communities is something that we've started, but it's in this COVID response, it has shown that it will work. It will work by reaching out to the communities.
And sir, what would you like to share with the nation regarding the current situation we are in, and what advice do you have for our people?
I think I'll still echo the daily announcements that are done. Our social measures, washing of hands, face mask, social distancing, avoid unnecessary gathering, avoid unnecessary traveling, because when we move, the virus moves. And if you get sick, stay at home, don't move around. And if you have breathing problems, you call early. Call 165. All health support will be there, and we will be there early, so that we can work together. Only by that we can overcome the impact of this COVID-19 virus.
Thank you so much, Doc, for joining us tonight, and all the best to you and your team for the work that are being done on a daily basis. That's it for tonight. I'm Kritika Kumar. Nisa Mode.